Hi guys, welcome you to another episode with M Moses. I'm a public health practitioner, and of course, that I work to support change, so that people around me and people around the world can have a certain knowledge to make profound choices, decisions, and as well as take control of their sexual lifestyle and general well-being. This is actually in the support of the global effort to end disease and pandemic worldwide. So guys, if you're new in this channel, kindly click on the subscription button so that you can have videos always. And also, if you have not subscribed and you've just been viewing, please kindly subscribe to these videos. Okay, if you like my videos as well, give me a thumbs up and don't forget to click on the like button. For my subscribers on this channel, I want to appreciate you all. You guys have been so amazing, and you have actually been a source of encouragement to me, so thank you so much. For those who are yet to subscribe to, thank you so much, because I know you're going to subscribe. Alright guys, it's really amazing today that we are having another topic that I promised us last week. Before I continue, I have some mails, and some people were asking questions. How do they get to, is it right for them to get hooked up or go ahead with their marital proposal because their partner happens to be negative? I said in this video, or I mean in my channel, I will be taking such counseling section, or better still, I can refer you to where you can get better counseling regarding that issues. However, if you are negative and your partner is positive, it's not a problem to worry about at all. Just email me on my email at madamiforjoy@gmail.com. I'm going to give you response as soon as I am able to see your message on my mail. Is that clear? But don't be afraid. You can get married to a patient or a patient who is positive, in as much as the viral load is very, very low. All right. Okay, without wasting much of our time, last week I talked about the fact that I'm going to be treating ways in which resistance develops, or how does resistance develop, how resistance, HIV drug resistance, develop in the person's body. Now, how does this resistance to anti-HIV drugs develop? Well, resistance can develop if you don't take your HIV treatment as prescribed, by your doctor at the right time, and every day. There's what we call adherence to your drugs. So you have to adhere to your time, the timing, the dosage. They are very, very important. Now, it is possible to have resistance to some drugs even before you start HIV treatment. I said that last week. And these things, if you do have that, you are likely to have a strain of those viruses that might later become resistant to HIV treatment drug later in life. So if you do have such cases, kindly go back to your doctor for further advices. Now, what does it mean if resistance develops? Now, drug resistant HIV could lead to the treatment not working in your body. Okay, you may be unable to use the same drug again in the future. That's what it means. And sometimes also you are unable to use other drugs in the same class of that drug, and this is called cross resistance. Now, the next combination of drugs you are given might be more complicated to take or even cause more side effects. That's why we don't want patients to default in their adherence activity. You have to adhere, otherwise you might be having complicated regimen given to you, because that's the only regimen maybe available for us at that time. Now, if you're able to take each dose of the combination therapy at the right time each day, then the development of drug resistance HIV is unlikely. Do you understand? That means that the drug will work for many years because you are adhering to the drugs. Okay. Now, what do you think, what can be done if you develop resistance? It's very simple. If you have developed resistance to your antiretrovirals, your doctors will need to look at your treatment history first and the result of the drug resistance test to decide the most suitable combinations of the drugs for you to take going forward. Now, there are now a numbers of anti-HIV drugs that work against a version of the virus that is resistant to other drugs. Do you get? Now, the recommended option for people who are resistant to the three main classes of drugs that I made mention, the NRTIs and the NNRTIs, and protease inhibitors are as follows. For example, one, we have protease inhibitors, which include duranavir and the likes of them. We have the entravirin, and so on and so forth. Down to we have fusion inhibitors, efuvetide, and the likes of them. Now, these drugs are most effective when used in combination with another drug. Now, let me don't even go into that particular aspect. That's why I don't want to mention those drugs. I want you to go to your doctor or your physician. This person will check you, look at your histories, counsel you, ask you some questions that will determine or will guide him or her to what other combination will be given to you that will suit you going forward. Do you get? So that's what I want you to do. It is very important that your new combination of drugs is taken properly. If not, you may develop resistance to those drugs too, and this could mean that your HIV will become very hard to treat. And when it becomes very hard to treat, guess what? The person is near to his grave. Now, how is the new treatment combination chosen? Is another question. Now, there is usually alternative combination of drugs available. Okay, one more suited to a particular lifestyle or with better overall result. Now, don't worry about being frank with your doctor. They will not be shocked by, or let me say, they won't be judgmental about anything you tell them actually. Okay, whether it's about using recreational drugs or the type of sex you are having. Now, the more honest you are, the easier it will be for them to prescribe you the right combination of drugs going forward. Before you switch, just make sure you know about the side effects of your new drug. Okay, the side effect of the new drug you are going to be giving. It's very important that you should know them before you are switching. If your doctors forget to tell you about the side effect, endeavor to ask them, sir, ma'am, please, what is the side effect of this particular drug I'm going to be taking? Is it going to be convenient for me to take? How is the dosage like? Do you understand? So this way you're going to help yourself by adhering to the treatment. Now, HIV medication reduces your viral load to undetectable levels. Once you are undetectable, you can't pass HIV on to any other person, and your health is actually protected. Do you understand? So don't forget, in my previous video I talk about side effects. Now, side effects from HIV treatment are not inevitable. I mention it all the time. And if they do occur, they are generally mild, easy to treat, and usually go away quickly. If you meet your doctor or your physician immediately, you discover that. Is that clear? So guys, I'm going to be rounding up here. In my next video, I'll bring your way something very palatable. I'm not going to disclose it now. We'll get to see it next week. So have a wonderful day. Enjoy your day. Bye.